Today on Investigate TV Plus, families left in limbo after their insurance coverage disappears.
And the bill was for over $300. And I was like, well, this is really strange. Why is this not being covered by insurance? And why am I getting this bill almost a year late?
We examine the mistake that left a young widow worried for her children's safety.
Plus, a poor prognosis leaves a father and football coach uncertain for his and his family's future.
The 5-year survival for those patients is actually only 9%. Even if they undergo systemic chemotherapy.
We take you on his emotional journey and reveal the treatment helping him beat the odds.
What I always tell people is you gotta keep on keeping on.
Then, meet the carpenter with passion and personality.
He's the same person at home that he is on camera. He's maybe even more goofy at home, but it's pretty great.
How he puts a new spin on a centuries-old trade.
In-depth stories that inform and inspire. You're watching Investigate TV Plus.
The cost of healthcare is crushing Americans. I'm Tisha Powell.
And I'm Lee Zurich. According to a 2025 report from the Commonwealth Fund, medical debt is a leading cause of bankruptcy in the U.S. And almost a third of working-age U.S. adults are currently in debt because of medical or dental bills.
But behind every bill is a person, in many cases, a family.
Like that of the McCulloughs, who found themselves suddenly without insurance.
While we found the mix-up is rare, reporter Carice Jackman uncovers a complicated problem it caused the family already mourning a great loss.
Jesse and I, we met actually through the fire department. I was a volunteer EMT and he was a volunteer firefighter with Prince George's County.
A father, a husband, a firefighter. 3 roles Susie McCullough says her husband Jesse loved the most in life.
He really liked helping people.
McCullough's public service as a firefighter took a turn in 2017 when he was diagnosed with an aggressive form of colorectal cancer.
It's considered for firefighters to be a job-related cancer. And so he was diagnosed at stage 4. So he was pretty much always considered most likely terminal. And he went through several months of chemo, he had surgery, he did some radiation, and then unfortunately in October of 2018, he passed away from the cancer.
Because he died of a job-related cancer, McCullough's death was considered line of duty by the state of Maryland. For 6 years, visits and billing were taken care of as expected. Then in 2024, a strange bill came for a well child visit her daughter had in 2023.
And the bill was for over $300. And I was like, well, this is really strange. From when I was looking at the bill, it looks like just a typical well child visit. Why is this not being covered by insurance? And why am I getting this bill almost a year late?
McCullough says the county where her husband worked accidentally canceled her coverage when she changed plans.
I called the pediatrician's office first. They told me that Cigna, our health insurance, had paid the bill and then had rescinded the payment several months later. So I called Cigna, and Cigna told me that they had received notice from the HR department with Prince George's County that my daughters were no longer covered.
McCullough immediately tried to get the situation taken care of, only to end up playing the middle person between the county's HR department and her insurance company.
I'm a healthcare provider myself, and so I take very seriously the importance of having health insurance. I think, they sort of treated it as a general complaint or inquiry to HR. They said you can submit your request and it'll be processed in the order that we received it. And I said, no, but this is really important because right now my children don't have health insurance. And if something were to happen, if we were to get in a car accident tomorrow, they would not be covered.
Oh, God, it's heartbreaking.
Dr. Elizabeth Rosenthal, senior contributing editor at KFF Health News, a national newsroom that reports on how the healthcare system works.
I mean, she's the widow of a firefighter. He died of job-related causes. And she was playing referee. That's a situation that so many of our patients are stuck in.
Dr. Rosenthal knows this waiting period between accidental drops places families like McCullough's in a tough situation.
I think it's a common problem, and people make mistakes, systems make mistakes, and they should be held responsible for them, not the patient. And this wasn't a huge bill, but nonetheless it was an unfair bill and an inaccurate bill.
As for McCullough, she kept pushing for answers. Growing tired of the back and forth, she informed our partners at KFF Health News about her issue.
Then the next time I talked to Cigna, I mentioned that I had done this, and then very shortly afterwards, the bill was paid.
Oh, what a coincidence.
Yeah.
Prince George's County says they are not aware of any lapse in insurance coverage and could not discuss the family's personal benefits, but remains committed to honoring the service and sacrifice of families whose loved ones died in the line of duty. And even though her issue was resolved, McCullough knows how difficult navigating insurance can be.
Thankfully, because I'm a healthcare provider, I have pretty good health literacy, and I was able to navigate all this, but it would have been really difficult to navigate if I did not have a healthcare background, or if I had difficulty reading, or if English was not my first language, or any multitude of things that would have made this impossible.
According to the U.S. Department of Health, you can appeal insurance cancellations through the company and also through your state insurance commission. Our team reached out to Cigna, which says it has 24/7 customer support and that it relies on employers' HR departments for accurate eligibility information and can work with employers on any coverage disruptions.
Thankfully, Susie was able to get her issue resolved, but we found even when patients are covered, they can still be surprised by what they find in medical bills. Take Kelly Reardon, for example. She's high risk for breast cancer and must undergo a breast MRI each year. When Reardon lived in Alabama, she says she received her MRI at an imaging center and was billed around $1,100. Her out-of-pocket cost totaled around $650. But her move from Alabama to North Carolina came with an unexpected cost.
Moving out here, I just assumed it would be the same. Knowing hospitals are maybe like a little bit more just because it's a different type of facility, but didn't expect quite the price change that I experienced with it.
And what was the price change?
So out here it was $12,000. So I was like, oh, okay, no big deal. They made a mistake with billing. They accidentally added a zero.
But it wasn't a mistake. Reardon went from being billed around $650 out of pocket to over $6,000. Consumer medical experts say that's because instead of going to an imaging center, Reardon received her MRI in North Carolina at a hospital facility.
Unfortunately, before you get care, we don't often know how much it will cost. Unlike any other products you would buy where you know the price tag, most patients don't know you're often paying more to get that care at a hospital setting because of what are called facility fees. I'm not sure if that's the case in this particular scenario, but often a hospital is going to charge you an extra fee.
She was in network for both procedures, received prior authorization, and had the same insurance. Now Reardon's on a payment plan. You can read the hospital's response to our questions on InvestigateTV.com. There you can also find out how to be your own investigator when it comes to finding the cost of your health care. Just search Hospital Price Calculator.
For people facing a devastating cancer diagnosis, a breakthrough treatment is giving them hope for survival.
I knew that it was going to open the door for a lot of other people, and it was going to probably change the way colon cancer was treated forever.
Still ahead, we take an in-depth look at the treatment giving one father a second chance.
And later, yoga is known for relaxation, but this type might also bring joy.
They're so sweet. He just came and wanted to sit in my lap the whole time.
We take you to the yoga session where you'll find puppies among poses.
It's a disease that takes tens of thousands of lives each year. Cancer.
While there are many different types, colorectal cancer is the third leading cause of cancer-related deaths in men and the fourth leading cause in women. The American Cancer Society estimates in 2026, more than 55,000 people will die from the disease.
Now, we want to talk about survival and the medical advances that are lengthening lifespans each year.
Reporter Viv Williams shares one man's inspiring story.
The man you're about to meet was diagnosed with colon cancer that had spread to his liver, a situation the American Cancer Society says happens in about 20% of all people diagnosed with colon cancer. If the cancer is limited to one area of the liver, surgery to remove it may be an option. But if the cancer is in more than one location in the liver, treatment options are limited, less effective, and prognosis is often poor. But thanks to a breakthrough treatment, this man got a second chance at life.
Everybody set, go. Here we go, push, 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 push.
High school football coach Shannon Jones would rather be on the field working with kids than just about anywhere else.
Push it, push it, push it. I'd always had to love football. Finish out, let's go.
But several years ago, Jones couldn't keep up at practices.
There you go. I got to where I would have to stop and sit down. I was out of energy.
It was colon cancer. And worse, Jones' doctor told him it had spread to his liver. He began treatment immediately with surgery to remove part of his colon and other treatments, including chemotherapy and radiation. But because the disease had spread to both sides of his liver, Jones' chances for long-term survival were low.
The 5-year survival for those patients is actually only 9%, even if they undergo systemic chemotherapy.
It was difficult. It was hard to push through sometimes. I always felt like there was something bigger in it and that it was leading to something and that I just couldn't quit. And you had to keep on.
His family and his love of coaching kept Jones going.
What I always tell people is you got to keep on keeping on.
Jones' treatments were working to kill the cancer, but they were also damaging his liver, making him very sick. When his hometown doctor explained the situation,
I told him I want to have a transplant. He said, you'll never have a liver transplant. That nobody does that for cancer. When you have cancer in your liver, you can't do that. And I said, I'm going to. And I remember him saying, no, you're not. I said, watch.
Jones traveled for a second opinion from Dr. Denise Harnoy, a Mayo Clinic transplant liver specialist.
One of the fields of transplantation that's really been expanding is what we would call transplant oncology.
According to Harnoy, until recently, liver transplantation for colon cancer that spread to the liver was not an option for several reasons. One being the risk of cancer cells spreading throughout the body, making the likelihood of recurrence in a newly transplanted liver high. This is particularly dangerous because people who have transplants take medication to suppress their immune systems so their bodies don't reject their new organ. Cancer cells can erupt in that environment.
When transplants were done, they very frequently developed recurrence of disease, and often very quickly after the transplant was done.
But thanks to advances in chemotherapy and other treatments that prevent colon cancer cells from migrating around the body, Mayo Clinic and a few other centers now perform liver transplants for highly selected colon cancer patients.
For those patients who have disease in the liver, it's not outside of the liver at all. It's not in the lymph nodes. It's not gone to the lungs or other organs. And their colon cancer itself has been treated, then now transplantation represents an option for those patients.
Jones went through a month of testing at Mayo to find out if he was a transplant candidate. After getting the okay, he began the wait for a donor liver to become available.
It was just one miracle after another that worked out for me.
Jones received the first liver transplant for metastatic colon cancer ever performed at Mayo Clinic.
I knew that it was going to open the door for a lot of other people, and it was going to probably change the way colon cancer was treated forever. All the way through, come on, don't quit now.
Now, he's back on the field.
Fast, that's it.
And has been cancer-free for 2 years.
When you talk to her.
Jones looks back with gratitude for the medical team that cared for him and the inspirations that made the fight worth it.
Football and baseball and my young kids at home, that's what kind of kept me going.
Both Jones and Dr. Harnoy say the real heroes are the organ donors and their families.
The organ donation is a critical piece of that puzzle.
To anybody that's not a donor or thinking about being a donor, please, that's a selfless gift.
Joan's doctor says liver transplantation is not an option for all colon cancer patients. She encourages patients to ask their care team about the possibility to make sure they consider all options for treatment.
Still ahead, when it comes to sharing his skills online, this carpenter nails it.
I was at one point making more money doing YouTube than I was working.
Meet the retiree inspiring others to tackle their home improvement projects.
But first, yogis find their inner peace with puppies.
Puppies just do a good thing for you. Like every time you see puppies, you just get happy.
We examine the science behind staying stress-free with your furry friends. Downward dog, warrior, and cobra. The benefits of yoga are supported by science. Studies show the ancient practice can improve balance, lower blood pressure, and improve mental health.
In Charlotte, North Carolina, among the poses, you'll find some paws.
Reporter Kim Anderson takes us to puppy yoga.
Forward, look all the way back.
It's yoga with a twist. These furry classmates don't exactly follow the poses, but they might be the best motivation to relax. In Charlotte, the downward dog has a whole new meaning, combining calm, connection, with just a pinch of chaos.
Yes, it's puppies and yoga. Like, why would I not want to do that? Everyone loves puppies and everyone loves yoga, and it's a great way to kind of bridge the two.
Jessica Sisse is one of thousands of yoga instructors across the country now hosting this new workout, combining a little sun and some wags, all with the same goal, inner peace through pause.
So how did it make you feel though with the puppies and the yoga?
Definitely very zen, very calm. They're so sweet. He just came and wanted to sit in my lap the whole time, so I was trying to relax with him and he was gonna make me go to sleep with him.
First-time puppy yoga participant Taylor Manley's reaction is real. Studies show contact with animals can lower cortisol levels and raise serotonin and dopamine, feel-good chemicals that boost mood and reduce anxiety. Call it mindfulness in motion, with a few friendly distractions. But these classes don't just help people, they're good for the puppies as well.
So with puppies, it's really good to socialize them. So I think also that's an added benefit, because just like bringing them out, it's just funny too. Like my first puppy yoga event, when you bring the puppies out, they're just like, who is these people? Like after like 10 minutes, they're just like, oh my God, this is so fun. They're running around everywhere. You can just see the difference of like being scared, not really knowing that many people, to now at the end of the class, they're just like socialize, having a good time.
Taylor Terry is the breeder of these precious furry yogis. Beyond the play, rest, and cuddle time, Terry says some puppies even meet future families in class.
A lot of people are actually dealing with anxiety and depression, so it's definitely a good place to just like decompress, and just puppies just do a good thing for you. Like every time you see puppies, you just get happy.
Research backs her up. Puppy yoga can lower blood pressure, ease depression, and even boost immunity, proving that sometimes the simplest therapy has 4 paws and a wagging tail.
I don't do yoga, but I do sometimes do push-ups, and Maple, my dog, will just come and just attack my face when I'm doing this. So I kind of feel their pain in there. It's so cute.
You know, they're a nice little companion when you're exercising.
I like it. It's good. Still ahead.
And this one piece goes underneath.
He brings Wi-Fi to the workshops. Well, sometimes.
Is it running? I've had troubles with this phone.
Meet the handyman sharing his passion with viewers across the globe. You can watch Investigate TV Plus anytime streaming online. Get the app for Roku, Amazon Fire TV, and Apple TV. It's free to download. It's a trade that spans centuries, and today a Vermont man is giving carpentry a modern twist.
What started as a way to share videos has turned into a platform for his passion.
Reporter Joe Carroll takes us behind the scenes of Ken's carpentry.
I saw you drive in, and I started.
Arriving in Linden, I receive a taste of my own medicine.
This is my daughter, Lauren.
A camera turned on me at Ken Grant's home.
I have the camera rolling. I wanted to see you like...
You see, Ken is a YouTube creator with millions of views through the years.
All right, let's do it.
Sure. With a tiny house, it's hard to get around sometimes. Hit like and subscribe.
I think it's part of who he is. It's just so charming to people. He's like Mr. Rogers and Bob Ross.
Is it running? I've had troubles with this phone.
His daily videos aren't slick, but real.
And this one piece goes underneath.
The retired home builder has been working on this tiny house since the summer, putting in 9 hours a week with the camera always rolling.
So that's that.
He'll sell this one when it's finished.
I was at one point making more money doing YouTube than I was working. We'll put the whole thing together. I'll be using 2-inch screws.
Simply put,
I had to go to the dentist and get a tooth pulled.
the more eyeballs watching his videos, the more ad revenue. But it's the comments that keep Ken going, including a mother of a young watcher.
7-year-old son watches your channel. I said, a 7-year-old son? She said he really likes carpentry and is wanting to learn stuff. I don't know, I really enjoyed that.
He's the same person at home that he is on camera. He's maybe even more goofy at home, but it's pretty great.
His followers are from all over the planet.
Quite a few people from Canada make comments.
And he responds to every one of them. From the tiny house to the big house is where Ken does his editing.
I have about 20 video clips.
Good morning, everyone. Guess what? This is a big day.
A most unusual shoot, where the happy dance brings the world together.
As of March 2026, Grant has about 200,000 subscribers on YouTube.
And that's it for us on Investigate TV Plus. I'm Lee Zurich.
And I'm T. Chappelle. Thanks for watching. On the next Investigate TV Plus, deep fakes are increasingly common in politics, and now there's concern about how those manipulated videos could impact voter thinking.
If we have manipulated images, that fuels extremism, it makes polarization worse, it makes us hate our neighbors even more than we do already.
We dig into artificial intelligence in politics and examine why some AI campaign ads go unchecked.